Hi there, this is Nursing Education Videos. Today I will be reading Hypernatremia NCLEX Review on registerednursern.com. All credit for this information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Hypernatremia NCLEX Review Notes. Are you studying hypernatremia and need to know some mnemonics on how to remember the causes, signs, and symptoms, and nursing interventions? This article will give you some clever mnemonics on how to remember hypernatremia for nursing lecture exams and NCLEX. In addition, you will learn how to differentiate hypernatremia from hyponatremia. Don't forget to take the hypernatremia and hyponatremia quiz. In this article, you will learn normal sodium levels, causes of hypernatremia, signs and symptoms of hypernatremia, and nursing interventions for hypernatremia. Hypernatremia. So hyper means excessive. Natre, so N-A-T-R-E, is a prefix for sodium. Emia means blood. Meaning of hypernatremia is excessive sodium in the blood. The other statements here is isotonic, hypotonic, and hypertonic tonicity. Normal sodium levels, 135 to 145 milliequivalents per liter. Greater than 145 sodium is hypernatremic. Role of sodium in the body. It's an important electrolyte that helps regulate the amount of water inside and outside of the cell. Water and sodium loves each other. Wherever sodium goes, so does water. The statement here is there's a video on hypotonic, hypertonic, and isotonic tonicity that you can watch from Sarah on registerednursern.com. For example, in hypernatremia, there is a lot of sodium outside the cell, and this attracts the water from inside the cell, which causes water to move outside the cell and dehydrate the cell. Sodium also plays a role in muscle, nerves, and organ function. Causes of hypernatremia. Remember the phrase high salt. Hypercortisolism. So these are the causes of hypernatremia. It's a mnemonic. High salt. H for hypercortisolism. Another name is Cushing's syndrome or hyperventilation. I for increased intake of sodium, either through PO or IV route, so the oral or IV route. G for GI feeding tube without adequate water supplements. H for hypertonic solutions. S for sodium excretion decreased, so body keeping too much sodium and corticosteroids. So S stands for sodium excretion decrease, means there's just not enough excretion of sodium from the body. A for aldosterone overproduction. Too much aldosterone causes hyperaldosteronism or Conn's syndrome. L for loss of fluids. Dehydrated, or you have an infection which causes a fever. Fever causes a loss of fluids from sweating. And then there's diarrhea and diabetes insipidus. T for thirst impairment. Signs and symptoms of hypernatremia. Remember, no fried foods for you, which has too much salt. So then the mnemonic is fried, F-R-I-E-D. F for fatigue. R for restless, really agitated, confused, and then the the central nervous system changes. I for increased reflexes, and it progresses to seizures and coma. E for extreme thirst. This is a big sign for hypernatremia. D for decreased urine output, or dry mouth and skin. Nursing interventions for hypernatremia. Restrict sodium intake. No foods high in salt such as bacon, butter, canned food, cheese, hot dogs, lunch meat, processed food, and table salt. Keep patients safe because they will be confused and agitated due to hypernatremia. Doctor may order to give isotonic or hypotonic solutions such as 0.45% normal saline, which is hypotonic and most commonly used. Give hypotonic fluids slowly because brain tissue is at risk due to the shifting of fluids back into the cell. Remember, the cell is dehydrated with hypernatremia, and the patient is at risk for cerebral edema. In other words, the cell can lyse if fluids are administered too quickly. Educate patient and family about signs and symptoms of high sodium level and proper foods to eat. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information.